are you doing?
Innovation Week 2023. Great conversations happening around the showroom floor. Exciting things going on in the industry. Why don't you introduce yourself? Tell us a little bit about what you do.
Sure. My name is Charlene Brophy, and I'm the CEO of a company called Fonemed. So we're an international telemedicine company based right here in Newfoundland, been in business for about 26 years now. And our bread and butter item really is providing health advice to a remote population of individuals who are in need of health care. So it may be over the phone, somebody calling in looking for advice for their child who has a fever, or somebody who's fallen and hit their head and so on. Or it may be more complex in a specialty program like disease control for people who have been exposed to pathogens. We've got algorithms based on the Center for Disease Control built into our platform, and we monitor and advise their care remotely and so on. And then throughout the U.S., we've got thousands of patients on biometric monitors. Could be oxygen saturation machines, could be blood pressure cuffs or blood glucose or whatever the case may be. And we monitor their health remotely, and if the need arises to intervene because their oxygen level has dropped or whatever the case may be, then we have nurses licensed in every state throughout the U.S. that will do.
Technology touches everything, and clearly it touches the healthcare sector. So much things happening in the healthcare sector right now, so much need for the type of solution that you provide. Tell me a little bit more about your technology. How do patients access it, and how do doctors get involved in supporting it, or healthcare professionals support it?
Yeah, so we designed the technology many years ago, and at the time when we designed it and brought on a team of software developers, it was really meant to support our operations for our service piece, because we manage today about 100,000 triage health information calls every month, with the base staying here in Newfoundland, but our population is right throughout the US, Canada, and elsewhere and so on. So the technology itself is built with clinical decision protocols built into the back end, algorithms, if you would, to manage any disease state in any population in any country and so on. And we've advanced that over the last few years to embrace the AI. Because when we look at healthcare today, we're all worried about sustainability and how we're going to manage an aging demographic and prevalence of chronic diseases like we've not seen before. So what we've done is built in the AI into our platform to allow patients to manage their own care when possible. So for example, if it's a patient who's wondering if they need to see a doctor because of a symptom or whatever the case may be, we've built the technology with symptom checkers so they can review their own symptoms and triage themselves. And throughout that process, if a trigger were to alert that, maybe this patient has something more serious going on. Let's say, for example, it's a patient who's calling in with a headache and they got a bit of a fever and so on. If the system triggers to ask, do you also have a stiff neck? Then that would trigger an alert to say, well, I think you need to talk to the nurse about this, because we wouldn't want to rule out meningitis, for example. And then the call will automatically escalate to our clinician. So the technology is all about how do we enable people to be able to understand the level of acuity of their symptoms and manage it at home.
Wow, what a sophisticated approach, right? Yeah. Triage, you use technology to help you triage the process. When it comes time for the patient to interact with a healthcare professional, what's that look like?
Sure. So there's it's an omni-channel platform, so they can, for the most part, the 50-plus population like to talk.
Right.
So they will simply call a toll-free number that we provided, can speak 24/7 to one of our nurses, but they can also text, they can communicate through an email.
Okay.
We've got video technology built into the platform, especially helpful if a patient has a rash, for example, to be able to assess what that would look like, and various injuries and so on. But the technology in the emergency rooms, we've got 7 emergency rooms on our platform to manage patient cares. So if the patient walks into the emergency rooms, determine they could avail of a nurse practitioner appointment because it's a non-emergency issue, they walk into a room, we've got our devices, our technology integrated with all of the telehealth room devices, so we can listen to our patient's heartbeat remotely. We can do cardiograms remotely and look at the results of this. We can look in ears and down throats and so on. So again, it's managing patient care, not having them wait for hours on end at the emergency room, because we can get the technology to interact with our human to provide the care and assessment that's required.
Wow. How do patients access it? I mean, this sounds like an incredible
Yeah.
offering. How do people access it?
Well, interesting enough, we provide services to about 40 million people throughout North America, and it's very different, as you can well imagine, on the Canadian side in a publicly funded system compared to a private system in the U.S. So on the Canadian side, any patient in any province in Canada can call 811 and talk to 811 services, and in several of those provinces, we're the back-end service provider that's providing that services, and that's how they can access. Or in Newfoundland and Labrador, we've developed our own proprietary app. Anybody can go on the App Store, download the app, and can communicate that way with our nurse or do a video conference for a nurse practitioner appointment. We've got about 50 nurse practitioners in Newfoundland today. On the U.S. side, of course, the private payer system, typically we're an extension of their doctor's office. They call their doctor's office, the doctor's office is closed, the call automatically flows over to our service, and we've got nurses working 24/7 in every state throughout the U.S. to manage those situations.
And all right here in Newfoundland.
All right here in Newfoundland and Labrador. In every nook and cranny that we could put somebody, we've got somebody.
I want to tell you, this sounds like an amazing technology. How is Technology Week going for you here?
Oh, technology, you know what? It's great. It's great to feel the buzz in the community. You know, we hear little pieces about it in news stories and so on, but to be in the room and just listen to the stories of other innovators who are local here and not out celebrating themselves because they're developing their technology to serve a need of a population wherever they may be. And there's so many innovators and entrepreneurs right here in Newfoundland serving a global audience that most of us did not even know existed. So just to hear their stories and go, wow, we love that. Newfoundlanders helping people all over the world. That's what innovation is.
What are you most excited about?
I'm excited about the future.
Yeah.
Where we're going, how we're going to do more of this, how we're going to make sure that every patient, every person anywhere in the world, regardless of the remote setting that they're located, can always feel that there's support for their healthcare needs at any point in time. So it's thinking about how we can use the technology. We put kiosks in any community center or any airport or you know, anywhere that there's a need for patients to have, or individuals to have access to care. It's just the sky is the limit. And then who do we partner with to enable that? Who are the people that need care? And let's not reinvent the wheel. If there's partners here in Newfoundland or elsewhere in Canada or around the world that we can work with to say, well, we together are so much stronger and we can serve a whole new population.
Well, thank you so much for being in conversation with us. I can tell you this is what making the world a better place looks like. So thank you very much.
My pleasure. Thank you for the opportunity.